Whenever you give somebody a cylindrical object, they put it on the ground, which they're supposed to do, and then they often just get on it and just kind of randomly roll back and forth. So it's just kind of this arbitrary rolling. People don't really know what they're doing, and that's foam rolling. Now, if we turn a little bit and we look at myofascial release, so the skilled application of myofascial release, it doesn't look anything like foam rolling.
Welcome to Self-Care for Men. I am pleased to have Kyle Stull as my guest today. He is the author of Complete Book of Foam Rolling. He has published multiple studies on foam rolling and self-myofascial release. He's a massage therapist, a certified strength and conditioning specialist, and currently a faculty instructor with NASM, the National Academy of Sports Medicine. Welcome, Kyle.
Thank you very much for having me. I'm very excited to be here.
Let's first talk about what foam rolling or self-myofascial release is. If you can
explain. Yeah, it's a great question, and it's oftentimes confused. You know, those two terms are used interchangeably a lot, foam rolling and self-myofascial release. However, if we look into the research, one of the things we see in the research and also the way a lot of people use foam rollers, whenever you give somebody a cylindrical object, they put it on the ground, which they're supposed to do, and then they often just get on it and just kind of randomly roll back and forth. So it's just kind of this arbitrary rolling. People don't really know what they're doing, and that's foam rolling. Now, if we turn a little bit and we look at myofascial release, so the skilled application of myofascial release, it doesn't look anything like foam rolling. Myofascial release is whenever a skilled therapist is going to find restricted tissue. They're going to apply a low-level force and sort of a tractioning force until a release is felt, and then they repeat that process. Well, if we look at the way these people are foam rolling, it doesn't look anything like self-myofascial release. So while we use those two terms interchangeably, there is difference between the two. So it really kind of depends. Now, we can take a foam roller and we can try to replicate myofascial release by slowing down whenever we're rolling, trying to find tender spots and hold pressure, but it really will never completely mimic or replicate myofascial release. So I wanted to start off with that. Whenever we talk about foam rolling, self-myofascial release, there's kind of some differences in those terms, but the goals are oftentimes the same. We want to use a foam roller to try to reduce tension. We can try to we can influence the nervous system to try to get this global relaxation effect. We can also use the compression from the foam roller to increase some fluid flow and get some blood to moving. We can also use that direct compression to try to mobilize tissues. So that's really what foam rolling is.
When would be the best time to use a foam roller?
That's another good question. It depends on the person. So with the National Academy of Sports Medicine, we position foam rolling to be something that's used pre-exercise, and we want to use it to try to prepare the body for activity. So really what we would do there with NASM's protocols, we would want to start off with an assessment process and try to identify muscles that are doing too much. They're short or tight or restricted, and we will use the foam roller on those muscles to try to help create some better extensibility, and that's going to lead to better performance or a better workout. But we also see in the research that using it after an exercise, again, going back to some of that blood flow and fluid flow, if we use it after exercise, we can speed up the recovery process, and we can even decrease some soreness that comes from higher intensity exercise. So you can use it before exercise. You can use it after exercise. Application would be a little bit different. It's also something great to use just whenever you're hanging out watching TV instead of just sitting there on the couch with bad posture. Grab a roller and you can work on some of those short, tight muscles.
We had talked a little bit before we started recording today about trigger points in trigger point therapy. Can you use foam rolling with trigger points to release trigger points?
That's I don't want to say a loaded question, but you can. So whenever we look at a trigger point, I would find a myofascial trigger point as an area of hyper irritable, bundle of tissue that, for whatever reason, and oftentimes it presents as a knot. Sometimes people call them adhesions, which again, those could all be different things, but a lot of times we use those terms interchangeably. Whenever we teach people to roll, we would teach them to roll slowly until they identify a tender spot. That tender spot could be a trigger point. It could just be an adhesion. It could just be a bundle of tissue. We don't know for sure. So we want to use our techniques to attempt to release trigger points. But one of the key things is, as a user, I don't necessarily know for sure if it is a trigger point. So I want to read some of this tension in these tender spots, but if I'm really interested in trigger point therapy or trigger point release, I would go out to a licensed therapist and have them identify it, see if it is actually a trigger point, and have them work on it.
Right.
One of the things with our application, we want to base our rolling techniques and our approach on movement. So instead of chasing pain and trying to go after these areas that we think are trigger points or knots or adhesions, let's look at movement, try to improve movement quality, and over time that can have a bigger impact on aches and pains and knots and things like that.
Okay, awesome. What about injury? Is it something that we shouldn't be using if someone has an injury?
It would depend on the injury. So if there is some sort of acute tissue trauma, we probably would a roller and jam in there and lead to even more acute trauma. However, if somebody's past that acute phase and the tissue is largely healed, then it's a great tool to use to try to just get tissues to moving again. A big thing with scar tissue is going to lay down after an injury, and that's just a part of the repair process, and we're glad it works. But a lot of times that scar tissue will just kind of lay down in a matrix that's not very extendable. We can use the foam roller and we can use other forms of stretching. So if we take a foam roller and we combine that with static stretching and dynamic stretching, we can potentially help to realign some of those fibers to make more of a functional scar tissue. So you can definitely use it after an injury has made it through that acute phase, and whenever we're starting to get some of that repair, we can use it to try to improve the quality or the formation of the scar.
One of the things I like to do when I am doing my own foam rolling is getting some movement of the muscle, shortening and lengthening the muscle when I hit those tender points, for instance. What do you think about that sort of method?
That's excellent. That's excellent, and that's one of the things I would say that's kind of the new wave of rolling that's coming. My research colleague, Dr. Cheatham, and I have published 2 studies on including active movements into your rolling, and it's almost like a pin and stretch technique, kind of like you're wringing out a towel. It's an excellent approach. And what we teach, or what we're going to teach in our newest edition of the corrective exercise textbook, is a 2-step approach with foam rolling. The first step is going to be rolling through the area slowly to try to identify tender spot, hold pressure, reduce tension. But then the second step is getting those active movements. So we would get some shortening and lengthening of that muscle under compression to really help maximize the effects of foam rolling.
Does your book show the different ways to foam roll throughout the body, different muscles? Maybe you can talk a little bit more about your book.
It does. So throughout the book, it starts from the foot, works all the way up to the shoulder. I can't remember right now if I included anything for the suboccipitals or not. Maybe up into some of the upper traps too, but it includes a very similar, like a 2-step approach. And that first step is bringing some blood and fluid to the tissues, but then that second step is going to be adding in some of those movements. So we're getting that lengthening of the tissue.
One of the other ways, and I think you mentioned this already, I like to use the rolling is like a pre-run, and then doing some dynamic stretching after that. And then when I get back from the run, maybe a little bit more foam rolling and then some static stretching. Is that, what do you think?
That's a wonderful approach. So looking at some of NASM's, what we teach at NASM, It depends on where the person is in their training. So if we identify muscle imbalances, and one of the things we use is just a simple overhead squat assessment. There's a lot of different ways to test movement. We just find it to be quick and easy. We use that to try to identify movement impairments, even though I know that word impairment can sound a bit negative. If we identify those types of things, what we would suggest using is foam rolling initially and then static stretching, even prior to exercise, because we are only going to stretch specific muscles. And one of the things we see, let's say, for example, that we identify an ankle, dorsiflexion limitation. Well, if I statically stretch the calves, it's going to lead to better ankle movement, which is going to lead to better movement in the hip, which is going to boost performance overall. So we can still use static stretching if we identify those muscle imbalances prior to exercise, and then we would repeat that post-exercise, rolling and then static stretching again. However, if somebody doesn't demonstrate movement compensations, or if they're further along in their training, then foam rolling, dynamic stretching, perform your activity, finish it up with, I even tell people, you can finish up with just foam rolling,
Right.
because that's what's going to help move some of the metabolic waste and stuff around to reduce soreness.
Right.
But if you have the time, throwing some static stretches in there works great too.
How important is hydration?
Most important.
Yeah.
The most important. So I recently had several phone calls with a guy from, I can't remember the name of the company, but the two biggest things that they found, and they're kind of a biometric company. So they're real big into heart rate variability. And this guy was telling me the two biggest things that influence HRV, heart rate variability, are sleeping patterns and hydration. So hydration is huge just in general. Whenever we look at something like foam rolling or anything dealing with tissues, so muscle, fascia, tendon, that type of stuff, hydration is huge, because that's what allows us to get those sliding surfaces to actually slide again. So we can roll and stretch and we can do whatever, but if we're dehydrated, the body just sticks together.
Exactly.
So hydration, number one in my book, hydration and get good sleep.
I agree. Absolutely. And I find that most people are dehydrated.
Yes.
That's one of the questions I ask my patients and students. How much are you drinking throughout your day? And most people are not doing a good job of it.
Me either. And one of the big things that we run into as well is somebody may do really well trying to get the amount of water there, but the other things that have a negative impact, so the caffeine, the alcohol, the stress, like all of those types of things there, they may increase the amount of water that you actually need to be hydrated. The other big thing I see with hydration is I can sit here at my desk and I can down a gallon of water, but that doesn't mean my tissues are being hydrated.
Exactly.
That means I'm going to spend a lot of time in the bathroom.
Yes.
So if I really want to get my tissues hydrated, I have to have a regular, consistent drinking of water and movement. The only way I can get hydration to my tissues is to move my body around. So it's really a whole big thing to making sure you're hydrated, other than just drinking water.
Right. And I also think it's important, besides water, that you mix in some electrolytes also.
Absolutely. We used to teach that the electrolytes are basically the cogs in the wheel, right? So those electrolytes are what's going to take the water and actually get it into the tissues where that true hydration can occur. So, and the same thing too, if you're just downing a bunch of water, you may get into an electrolyte imbalance. So, so that's huge.
Yeah. There's a lot of self-myofascial release tools out there.
Yes.
I mean, a foam roller is a foam roller, but there's a lot of self-myofascial release tools out there. How do people choose what's the best for them, or what's a good one?
That's a great question, because there's a lot of stuff out there. Even this cool thing, which I actually really like this particular one here. So we did a study where we tried to look at the visual analog scale, so a pain rating scale. And one of the things we wanted to try to do was identify, or see if we could correctly identify somebody's level of discomfort on a roller. And one of the things we found from this particular study is that getting into this, I thought that harder rollers were better. because something that's a little bit harder is going to influence more layers of tissue, and overall it's going to be more impactful. One of the things we found with this study, though, is they're not better. Most of the time, harder rollers with average study subjects anyway, they're too hard. People can't relax. People can't actually breathe and try to let their muscles and their tissues actually relax and change. So after going through that study, one of the things I started changing about my recommendations is, if you're new to rolling, find the softest roller you can get. Whether it's even if you just go to Walmart and get a swimming pool noodle, something that has a lot of give, something that's very, very soft, to just get started, start easy into it. The last thing we want to do is create more trauma or more stress or more pain. Most of us are already dealing with pain. We want to use the foam roller to actually draw the pain out. So start very, very soft. You can get something that's foam, that's fine, or different types of materials, doesn't really seem to matter. And then just slowly start to progress from there. After you work with that really soft one for a couple of weeks and you're starting to feel a little bit better, then you can invest in something that's a little bit harder and then slowly progress up. One of the other studies we did, we looked at texture. So we found that some sort of a roller, and I keep looking around because I should have rollers around here and I don't. A textured roller is going to be better than something that's perfectly flat. Now, there's nothing wrong with working with one of those smooth, flat rollers, and I encourage people to use that a little bit as well. But those rollers that have a little bit of texture to them, it creates a differential in the pressure as they're rolling, and that seems to stimulate the tissues a little bit better than something flat. So I would start soft, get a flat one, and then get a little bit harder as you get more experienced and invest in something that has some texture to it, because that's going to stimulate those tissues a little bit differently.
You had mentioned the nervous system earlier. How does foam rolling affect the nervous system?
It can have a couple of different effects. Now, if we follow the approach of getting a soft roller and rolling slowly, making sure we're being mindful of our breathing, our posture, and our positioning, one of the things we see with foam rolling is we can activate more of that parasympathetic side, so that relaxation side of the nervous system, that rest and digest system. But that's a combination of things, right? So that's a combination of that direct pressure from the roller, making sure it's not so much pressure that it's sending us into a stress reaction, and that's combined with mindful breathing. So those two things together can activate that parasympathetic side of the autonomic nervous system, as a great relaxation effect. However, we see if somebody takes a much harder roller and they're much more aggressive and they're rolling faster across there, if they look like they're trying to start a fire between their leg and the roller, we see that has an opposite effect. That excites the pain receptors, and that's going to excite that sympathetic response. Sometimes people want that for whatever reason. They're going into performance or activity, and that's they want that excitement or that engagement. You can have that different approach. Most of the clients I work with, though, they're stressed out enough. I need to calm them down. So we're going to roll slowly, we're going to breathe, and then we're going to slowly start to build back up into movement.
Yeah, because when you were talking about the harder foam rollers, or how it, that pain response, and I was thinking that it's going to initiate the sympathetic nervous system, which is what we don't want. I feel that, particularly in our culture, everyone's so stressed out already. We want to really help them access the parasympathetic nervous system to balance the nervous system, as opposed to contributing more to that stress response.
Yeah, I absolutely agree. And one of the things, I've worked in many different gyms. I've had great experiences as a fitness professional working for different companies. But one of the things that I still deal with today is the people talking about this relaxation that we're talking about prior to exercise. And the thing is that, most of the time clients are already stressed out, they're dehydrated, they had some sort of a pre-exercise drink, they've been listening to angry music on their way to the gym. So the first thing I need to do is calm them down.
Absolutely.
Let's calm down. Let's get you balanced out a little bit. And then I'm going to be able to teach you these new movement patterns. Then we're going to be able to move into a much more impactful training session. But that goes against what people think, right? They think I need to come in jazzed up, angry, just ready to lift big weights. That's how you get hurt.
Yes.
So it's taking a few minutes, calming down a little bit, and then we'll start to engage in some movement patterns, and then we'll build back up slightly so we can enter into that higher level of training, much more aware of what it is we need to be doing.
Mm-hmm. I've always wanted to ask someone who knows about foam rolling about the IT band, the iliotibial band. You hear so much about foam rolling the iliotibial band, and I've done a lot of cadaver dissections. I've seen that tract of connective tissue, and I don't think there's any way you're going to be rolling that out. What's your thoughts on foam rolling? Yeah.
There is. So we actually should have started with this question. A couple of things about the IT band. I absolutely agree. After doing some dissections myself, absolutely agree that the roller is not going to change the length of it. It's non-contractile tissue.
Mm-hmm.
It doesn't shorten, and it's not going to lengthen. So what we have to look at are the tissues that attach to the IT band.
Exactly.
So we see, towards the top at the hip, we have the TFL on the anterior side, superior fibers of the glute max on the back side. That's our imbalance there.
Exactly.
So if somebody has those sensations of a tight IT band, 9 times out of 10, it's that anterior side being short and that posterior side being lengthened. So we start there. But one of the other things, I guess my model's back there. One of the other things we have to keep in mind, that IT band goes over the vastus lateralis. So the largest and most powerful quadricep is right there underneath that IT band. We oftentimes see that vastus lateralis becomes overworked and hypertrophied for a couple of different reasons. And as it hypertrophies, it pushes into that IT band. That IT band now bows over the vastus lateralis, and that again creates the sensation of tightness.
Mm-hmm.
Now, one of the things whenever we teach rolling the IT band, the intent is not to release the IT band, it's to reduce the tension in the vastus lateralis underneath the IT band. But I'll be the first to say that's not communicated well.
No.
So everybody talks about rolling and stretching the IT band. And I'm with you. I just don't think you can do that.
No.
Our goal is to try to reduce that tension and those quadriceps underneath, and that's going to it's going to reduce that feeling of tightness in the IT band.
Absolutely agree with you. In the body work that I do, the TFL, the glute maximus, and then, as you said, the vastus lateralis. Because people will roll that outside part of their leg, and they say, it's to get these points that are really painful, and it's the vastus lateralis. It's not the IT band that's creating that.
Absolutely.
That pain.
Absolutely. One of the things that we started teaching whenever I worked for a previous company, instead of rolling perfectly lateral on it, so I think it's okay to put it right on the outside and roll the IT band, as long as our intent is to reduce that tension in the vastus lateralis. But we started teaching just rolling forward, maybe 20 degrees or so that the foam roller is just slightly anterior of the IT band, and we can really get into that vastus lateralis, so it gets us off the IT band directly on it. We're still on that anterior side, but it really gets us into that quadricep. And that's another big one there, rolling that vastus lateralis and getting some knee bend, so 3 or 4 knee flexion movements.
Yes. Yeah.
Activating that hamstring is going to inhibit that quadricep, and we get some great results from that.
Right. Yeah. And as you said, it's all about that sliding and gliding. That's what we need to be working on.
And I agree.
And as you said, our bodies are not meant to be sitting for lengths of time that we do. So getting up and moving and getting the fluids moving in our bodies and the muscles, and so important.
Yeah, and I think that's one of the things to talk about with foam rolling too, is we use that foam roller as sort of an external object to try to get some movement. I'm sitting here all hunched over as well. I was thinking about my chest. But if I take that roller and I'm face down or up against a wall or something, and I just get some movement here through these tissues, it's going to really improve my ability to stretch them and gets that hydration and stuff in there as well. So
Right.
just using it to unstick stuck things.
Exactly. If someone wanted to reach out to you, they had some questions, how would they do so, Kyle?
Yeah, I would hit me up at my NASM email. So it's my first and last name, Kyle, Kyle Stull, Stull, at NASM.org. I'm usually, that's my full-time job, so I'm usually on that email quite frequently. So shoot me an email there. I'm happy to answer any questions. You know, I've taught 4 and 5 day workshops on the foam rolling, so I could talk and talk and talk and talk. If anybody has questions, please feel free to reach out. I'm happy to talk through things there too.
Awesome. And I'll post that, with this video.
Excellent.
And also make sure you click on my subscribe link for my YouTube, Facebook, Instagram, and LinkedIn platforms. Again, thank you, Kyle. It was very informative. Always love talking to someone who's knows what they're talking about and is passionate about it. So I appreciate it.
Well, great. Thank you very much for having me.
All right. Take care.
Thanks, Ed.